All right, let's go ahead and get started. Good afternoon, everyone, and welcome to today's webinar on investigating fall fatalities and injury claims on prevention efforts. I'm Scott Breloff, Acting Coordinator in NIOSH's Office of Construction Safety and Health, and I will be moderating today's session and the question and answer following our panel's presentations. The National Campaign to Prevent Falls in Construction was launched in 2012 through the NORA Construction Sector Council, with leadership from NIOSH, OSHA, and CPWR. Each year, as part of the campaign, safety stand-downs are held by employers across the country to focus on fall prevention. In support of the campaign and stand-down, our three organizations have conducted several webinars in the past, as well as created a variety of fall-related videos, all of which are in a playlist located on CPWR's YouTube channel. The NIOSH Fatality Assessment and Control Evaluation, or FACE program, investigates fatalities that occur on the job and provide the public with full access to these investigations. The FACE program targets deaths associated with falls in construction. This webinar will explore the characteristics of workers and employers who have been involved in fatal construction falls and the impact injury claims can have on small construction leaders' participation in fall prevention efforts. That's why we've invited Dr. Todd Schoonover, Dr. David Hurtado, and Dr. Anthony Oberry to discuss how these FACE programs help track and prevent construction fatalities. Dr. Todd Schoonover is an industrial hygienist at the Washington State Department of Labor and Industries. He works in the Safety and Health Assessment and Research for Prevention, or SHARP program. Dr. David Hurtado is an assistant professor at Oregon Institute of Occupational Health and the Oregon Health and Science University, Portland State School of Public Health. He's representing the Oregon program today. And Dr. Anthony Oberry is an assistant professor at Michigan State University, Division of Occupational and Environmental Medicine. He will be representing the Michigan FACE program today. And with that, I hand it on over to Dr. Todd Schoonover.
Thank you for the introduction, Scott. And along with Randy Clark and Eva Glosson, we are Washington FACE. Thank you for the invite to this webinar. Our presentation is characteristics of workers and employers involved in severe construction falls. While Washington FACE is primarily focused on fatalities that occur due to falls, this presentation will be using fall injury data. So these are workers who were injured in falls, but they are not fatal. So our definition of a severe fall injury in construction is that it's a worker who files an injury claim due to their fall. So our source of information is the Washington State Workers' Compensation System. We only looked at workers who were hospitalized within 1 day of their injury, and their hospitalization and injury resulted in what we call a compensable claim. This is an injury that involves wage replacement, disability, or death. We looked at all injuries in the NAICS 23 construction industry sector. We only looked at falls by two event types. One was fall to lower level, and the other is called fall unspecified. And where available, we used the most detailed level to characterize falls. We only looked at fall injury dates for these records between 2015 and 2019. Here's a simplified flow chart of our injury data. It shows that basically all of the falls occurred in the NAICS industry sector. There were 453 workers hospitalized due to severe fall injuries. Among those workers, there were 437 employers. There were 15 employers who had more than one injury during this 5-year span. And each worker who fell and each employer who had a worker who suffered a fall is assigned what we in Washington call a risk class. And combining those two elements, we were able to generate fall injury rates by risk class. So what are these risk classes and why do we use them? Well, basically, the risk class describes the risks that workers face, unlike a NAICS industry classification, which really describes the economic activity of an employer. Risk classes are assigned to employers so that each employer has multiple risk classes. For example, not only do they have construction work, but they have clerical and transportation and all of those different things that they do. Whereas NAICS is a singular classification assigned to employers. Risk classes are assigned by risk specialists. NAICS industry classifications are assigned by what we call employer services during the licensing process. The risk classes are used to determine how much the employer pays for insurance rates, whereas the NAICS industry really doesn't have any influence on the compensation insurance. Also, our risk classes are updated periodically by our risk assessors, whereas the NAICS industries are rarely updated. So this first chart, I'm going to show you our fall rates by our risk classes. What you see are the top 10 risk classes with the highest rates. Roof work had the highest rate at 5.5, and these rates are fall rates per 1,000 FTE. That's an hours-based rate. The second highest would be exterior painting. That risk class rate was 3.7 per 1,000 FTE. The third highest would be building construction, specifically wood frame, with a rate of 2.5. Altogether, among these injuries, there were 62 risk classes assigned, whereas there were only 26 NAICS industry classifications assigned. So the risk classes are more detailed, more diversified, provide a better understanding of what's really happening. This next slide shows the number, not the rate, of fall injuries by event type. What we have here are the 8 highest fall types. These make up 94% of all the fall claim injuries. The highest by event was fall from ladder at 190 falls, or 42% of all of them. The next highest was fall from roof, unspecified, which there were 79 falls, or 17%. The next one that I'll point out is just fall to lower level, which was 55 falls, or 12%. I'd like to point out that here you only see 2 types of roof-related work, but in our data, there ended up being 6 types of falls, so 6 fall categories, which I consider related to roofing work. And when you combine all of these 6 categories, there were actually 113 falls, or 25% of all of the falls. So I think that's worth pointing out. Another thing that's worth pointing out is that there were 9 women who suffered severe fall injuries, and 5 of them fell from ladders. This next chart is showing how long the worker was with that specific employer before they suffered their fall injury. From left, the categories are 1 month or less, 1 month to a year, 1 to 5 years, 5 to 10 years, and 10 plus years. So pretty dramatically, 20% of these workers fell within their first month of work. But even more dramatically, I think, when you combine the first 2 categories, 50% fell within their first year with their employer. This next chart is showing how long the worker was away from work following their fall injury. This is where the money stacks up. Costs to employers stack up. So from the left, the categories are none, 1 day to 1 month, 1 month to 1 year, and 1+ years. So understandably, you may be scratching your head about this none category. And what it really means is that these workers were not paid by our workers' compensation system to be off work, but their employer actually pays them and does something administratively called keeping them on salary. And what this does ultimately is save the employer money in insurance rates down the road. So it's not that these workers didn't have any time away from work, it's just that they didn't get any payments from our agency. I'd like to point out that, you know, on the far right, 37% were away from work for a year, and when you combine the rightmost categories, that's 66% that were away for a month or more. Our next chart here is how long the employer was in business at the time the worker fell. From the left, the categories are 6 months or less, 6 months to a year, 1 to 5 years, 5 to 10 years, or 10 plus years. So a full 39% of the employers where these workers fell were in business for 10 or more years. And this was rather surprising to me. Another way to look at this is 31% were in business 1 to 5 years, although this is a pretty long time span here, 1 to 5 years. Our last chart here is pretty interesting, and this shows the fall rates per worker categorized by the size of the employer at the time of the injury. So the categories are 5 or fewer workers per employer, 6 to 10 workers per employer, 11 to 50 workers per employer, and 51 workers per employer. So basically left to right is the really small, getting larger employers. And this is actually some new data we have access to where the employer reports the actual head count at the time of the injury. This is not an hours-based number. This is how many workers they had working for them at the time. And we can see that the smaller employers had the highest rates of falls, and it consistently and dramatically decreases as the employer size increases. That's our last chart, and to summarize what I see in this data, I'd like to say that workers classified in roof work of all kinds, exterior painting, and wood frame construction risk classes suffered falls at the highest rates. Workers fell from ladders and from and through roofs most frequently. Half of the workers experienced a fall within the first year of their employer, with their employer. 37% of workers who fell were away from work for a year or more. Fall rates were highest among smaller employers and consistently got lower as the employer size decreased. What we're going to do with these data in the short term really is communicate some of it by risk class or about the risk classes, the events, to our state OSHA and our state construction apprentice training programs. And we're going to use it to focus some of our fall prevention efforts during our campaign toward employers doing roof-related work. For example, last year, almost all of our efforts were focused on employers and ladder falls, whereas we now are seeing that roof work is pretty much equal if you combine all of them together. We're going to also do some more focused efforts towards interior and exterior painters and smaller construction employers, which we have always had a focus, but I think it really renews our emphasis on this. That's the end of my presentation. Oh, I will point out some limitations in our data. The risk classes that I'm talking about are pretty exclusive to Washington State. They're not really reproducible by others, and they're also difficult to compare to NAICS industries, as I pointed out. There can be a mismatch between the assigned risk classes and the task that was actually being done, but as these risk classes are updated pretty frequently, it's not that common, but it can happen. Worker tenure is self-reported, and not all workers reported their tenure, so there's a little bit of uncertainty in that. And with that, that's the end.
Thank you very much for your great presentation. And then we will pass it over to Dr. David Hurtado.
Hello, everyone. Thanks for the invitation. My name is David Hurtado. I'm an assistant professor at the Oregon Institute of Occupational Health Sciences. I'm also an investigator with the Oregon FACE program. And on behalf of Ryan Olson, the PI of the program, and all our team, we're very pleased to be here. The title of my presentation is, Does Experiencing an Injury Claim Impact Small Construction Companies' Leaders' Participation in a Fall Protection Survey? So I want to start very quickly with the rationale for conducting this study. As the previous presentation was mentioning, small residential construction companies represent a significant burden for occupational falls. And despite this burden, these companies, small residential companies, which account for a significant portion of the sector, they're very notoriously hard to reach for prevention and training. So that's an issue because that's precisely the sector that needs the most attention. And we know from academic publications that the response rate for surveys tend to be low, ranging from 10% to 35%. And this compounds the issue that it's not also the risk of a fall, but the potentially exacerbating occupational health disparities, as this subsector tends to employ immigrants and workers from low socioeconomic status communities. So we wanted to reach out for these companies, and we wanted to test whether companies that experience a recent fall documented by the insurance company would be more likely to engage with a survey about fall protection. And a second objective of our study is that we want to describe the general knowledge and familiarity with the fall protection equipment of leaders from those companies. So we rely on the motivating operations theory that essentially states that an adverse event motivates people to change their behaviors in order to avoid the negative consequence of the adverse event. So in this case, we hypothesize that companies that experience a recent injury claim would be more likely to engage with the survey because they would also be willing to reduce the negative consequences of a future fall. So in order to test this hypothesis, we partnered with Safe Corporation, which is the leading insurer in the state of Oregon, covering about 60% of the market. And they drew a random sample from their policyholders in this subsector. And they were so instrumental for the study because we were able to draw two samples. One that had a fall from elevation in the study period, that is from January 2016 to March 2018, and similar companies in terms of size, region, and premium that didn't experience a fall in the same period. So we could do some comparison. I wouldn't call it like a case control study because there are more methodological considerations, but at least we could draw some comparisons in these two subsamples. So SAFE mailed our email survey to the policyholders, and we did it in a double-blinded process so that SAFE didn't know the actual responses from their policyholders, and we, the researchers, we didn't know the names of the companies. All the information was linked through a research identifier that I'll explain in a little bit. And in order to incentivize leaders to participate in this study, we told them that we were going to conduct a raffle with fall protection equipment. So it is customary in many survey-related research to consider that a survey is completed if a participant responds to more than half of the contents of the survey. So we use that threshold with a binary variable. So to indicate if someone completed at least half of the survey. And we tested familiarity and use with fall protection equipment using this article by Cascutas, in which they listed 10 pieces of equipment that are typically used in residential construction. So here's in the next slide, you can see the pieces of equipment that we asked about. And we measure from I'm not familiar to this, I use it frequently, or I use it regularly. System, I measure from 0 to 2. So here are the main results. The survey was mostly completed by owners, presidents, or manager leaders from residential construction companies, so people in leadership positions. And the companies were had an average size of 11 employees, so very small construction companies. So our overall response rate was 22%, which tends to be low, but considering this is a hard to reach subsector, this 22% response rate is quite encouraging, and it's within the range of what the literature shows. And here's the main hypothesis. So of the people that were emailed by SAFE, 33 and 30 from the injury claims groups provided the ID link so we could know, so we could link it back with SAFE records. And we found that the leaders of companies that had experienced a recent claim tend to engage with the survey more often than those leaders from companies that did not experience a claim. So we found evidence for a hypothesis. Let me say that again. So leaders from companies that experienced a recent injury claim were more likely to complete at least half of the survey than those leaders from companies who did not experience a recent fall. Across the board, familiarity with equipment was low, but those who engaged with the survey had more familiarity with equipment than those who did not complete at least half of the survey. So this is concerning because the people who reported less familiarity also were more likely to not engage with the survey. So here are the main findings again. So we found evidence that a recent fall may act as a trigger event. And fall protection familiarity and use was low across the sample, but representatives from companies with less equipment familiarity also engaged less with the survey. So what does it mean for research and practice? So we obviously believe that engaging in research and in prevention with these companies is very important, but we need to revisit the ways we're trying to approach or engage with these companies. So perhaps a good starting point is to engage with more established companies. But we also need to rethink our tactics for harder to reach companies. And community-based recruitment strategies can be useful here. And the other potential point of improvement is that the timing of outreach can also have an important role. So perhaps engaging for protection and prevention research or practice could be more valuable if this happens shortly after a fall or a serious event. So we believe our study has several strengths. We partner with a leading work compensation insurer, and we do a random sample. However, it was a small sample size, lots of missing data as you saw in the table. And we don't know the extent to which, there could be some bias in terms of answering a call from their insurer. So we're happy to report that there's been progress in our raffle, and I'm running out of time, so I'll skip that part. And please let me know in the Q&A if you have any questions. And here's my email for future questions. Thank you so much for your attention.
All right, thank you, Dr. Hurtado. And moving right along, we're going to go to Dr. Anthony Oberry now.
All right, hi everyone. As mentioned, my name is Anthony Oberry. I am faculty at Michigan State University in the Division of Occupational Environmental Medicine, and I help run the Michigan FACE program there. So as you've gathered from the other presentations today, kind of the goal of the FACE program in Michigan and elsewhere is to track and investigate work-related fatalities. And I want to note, because it will be important in a minute, that this is overlapping, but not exactly the same scope as in Michigan. We have a state program, so as NIOSH or as OSHA in other states. And so we're able to gather all this great data regarding fatalities and work-related incidents around the state. And we can use this data, in some cases very detailed data, to create a number of tools that we use for safety training, education, outreach, and the like. And so the goal of my talk is I just wanted to give kind of an overview of the types of these tools that the Michigan FACE program has produced. And so I'm going to start on the most detailed end of the scale, and these are our investigation reports. And I believe the webinar that was mentioned that's going to be happening tomorrow will involve some investigation reports from other FACE states. But what these are in-depth looks at a single incident. So if we get notified about an incident, what we can do is we contact them, and we, with them being the employer, and ask if they would like to participate. It's voluntary. And so this is by no means a comprehensive sample of the fatalities that we see, or even a representative sample, but it's mostly self-selected by those who choose to participate. And so these reports, over the course of interviewing them, reviewing relevant files, we can get quite a bit of background info. We can create a very detailed narrative of what happened, and we can identify some root causes and contributing factors and recommendations. And so to give you I realize these are small and blurry, I'm just trying to give you an overview. I have links at the end for you to go look at these if you'd like. And as I mentioned, these are similar to the types of reports other states create too. So you can see here, these are the first pages. These are two that we completed recently, one on someone falling through a skylight and one on someone falling from a stepladder / platform that was unwitnessed, so it's unsure. But you can see this front, even on this front page, we break it down by a summary of the incident. We identify some key factors, and we start making recommendations. And so I've actually skipped here to those portions of the reports, the respective reports. You can see what we do is we break down these contributing factors and kind of bullet point them. And then for each contributing factor, we try to come up with a recommendation for best practice or for relevant standards, as you can see on the case on the left related to NIOSH. Related to NIOSH standards, so that we can identify things that would have perhaps prevented the incident in these specific cases and may prevent incidents in future cases. And so these are great detailed reports on single incidents that I know for a fact that employers and trade groups and unions in Michigan use as case studies when they're doing trainings to really be able to dive deep into an incident and see all the different factors of the work site, of the employer, of the worker that came together to create the perfect storm of a fatal incident. Moving up one level, as far as detail goes, these are still focused on a single incident. So what we do, as I mentioned, our scope isn't exactly the same as NIOSH's, but generally if NIOSH investigates fatality, it's one that my FACE would be interested in too. And so we have an agreement with NIOSH wherein whenever NIOSH inspects a case, we're able to interview the compliance officer, the NIOSH compliance officer who does the fatality inspection, and interview them. In some cases, review the NIOSH case files. We review our own files that we're able to obtain. And we create kind of a one-page summary of NIOSH's inspection and the relevant citations NIOSH levied when applicable. And to be clear, these are different from our investigations. Not every NIOSH inspection is one we go on to do an investigation on. That depends on the voluntary participation of the employer, and not everyone we do an investigation on is in NIOSH's scope. And so these kind of look like this. It's just a one-page sheet. We have about a paragraph-long summary of the case, and then we kind of break down whatever citations are levied and how those citations apply to the case at hand. NIOSH, these are listed on our websites, and NIOSH will also cross-link them from their own website that details NIOSH in-scope fatalities. And so then moving up another step, every year we create an annual report, and this is where we kind of start to look at trends as opposed to individual cases. And so our annual reports kind of summarize all of the deaths that happen in a given year. We just finalized and published our 2018 annual report. We're working on our 2019 report right now. A great deal of the report discusses trends within that year, how all the deaths that year broke down by industry, occupation, age, employer size, et cetera. And sometimes, and for certain things, we get into some discussion of trends across years. And then at the end, we have an appendix which has a short narrative of every death. So any death that we don't have an investigation report on or a NIOSH summary on, there's at least a couple sentences on it in the back of our annual report. And so I just wanted to highlight here on the left, this is one of our kind of discussions of the construction industry from our 2018 annual report. You can see at the bottom, we included a graph that looks very similar to graphs NIOSH and CPWR have shared throughout this week, detailing fatal falls as a percent of total construction deaths by year in Michigan. And on the right is an excerpt from the appendix of that one of this year's annual report. You can see here, this is from it's broken down by industry and then type of death. So these are construction falls, and you can see summaries of 4 of them here. And then in any case where it is a NIOSH inspection, we link to that inspection summary that we've done. And if it's a MyFace investigation, as in case 35 here, we also link to that. And then finally, we created a series of hazard alerts that really identify and discuss hazards that we see across years. Maybe in any given year, there's not enough for it to be brought up within an annual report, but across years, it really starts to be a trend. It starts to be a recurring hazard that we see. So we create these hazard alerts. They're generally 1 to 3 pages long. We summarize some of the cases and the statistics we've seen from MyFace, and then we kind of get into preventative tips, and we generally link a whole bunch of resources from groups such as OSHA, NIOSH, NIOSH, and CPWR for further information if people want to do a deeper dive into how to prevent them. Wrong direction. And so we've done 3 pretty recently, either that we developed from scratch or significantly updated from quite a while ago. And so this is our overall fatal falls construction one. We have some stats that we break down. It's hard to read, but the left graph is the number of falls by type of fall or by surface fallen from. And on the right is height fallen from. We have some examples, and then we, because there's so much to say about this, we opted to spend less time giving our own tips, just highlighting the plan, provide, train guidance that OSHA provides, and then giving quite a bit of space to resources from all the groups I mentioned. And we have 2 others that we've developed for specific types of falls. This is our roof safety hazard alert. Generally, it's hard to read again, but that bottom pie graph is by industry, and the red portion is construction. So these are mostly construction falls from roofs. Same thing, we have tips and resources. And then we have another one on scaffolds, falls from scaffolds, again, primarily construction. And so I provided links to all of the things I just discussed right here. You can also feel free to peruse around the website. We have plenty of hazard alerts on other topics, investigations from other industries and other types of death. But hopefully, as I mentioned, I know that these are often used for things like toolbox talks, for training in Michigan, and we use them ourselves when we do some educational and outreach sessions, and I hope that they can be of use to you. That's the reason our programs exist. And here's my email address if anyone has any questions to discuss later.
All right. Well, thank you all for your wonderful presentations. We have a couple minutes left for questions, and so we'll get right into that. The first question that came in ahead of time is, what would you say is the most effective tool to prevent workers from not complying?
This is Anthony. I can
Okay, thanks, Anthony.
Yeah. Something that I think we've noticed and is common in a lot of these is the idea of kind of safety culture. I think workers will comply and take the steps needed to work safely when that's the culture of the employer and the work site. And I think that there's a lot of things that go into this, ideas such as stop work authority, that other workers should feel comfortable calling out unsafe conditions they see or unsafe behaviors they see on the part of other workers, and stopping work accordingly until they're addressed. But even just things like right before this, I was actually listening in on NIOSH's webinar, and someone there said something, someone I believe from a trade group mentioned that they were on a construction site once, and that someone's, they heard the employer say jokingly something to the extent of, if you fall, you're fired halfway down. And that, again, he was joking, but that's that kind of, it really takes the example of leaders on the work site, of the employers, of supervisors to show that they're taking safety seriously. And I think if that happens, that's the biggest contributor to workers taking safety seriously as well.
All right, thank you. David or Ty, would you like to add to that?
Yeah, I would like to add. I subscribe to Anthony's point 100%. I would also mention that to the extent that we can tie the workplace to a larger community, we could have more success in compliance. And all the crises that this year has brought us has just showed the importance of just community ties. So emphasizing that aspect, I think, is the way to go. And to the extent that we can link prevention efforts to other type of community resources, I think that can go a long way.
Excellent. The next question, I believe, is tied to this, so we'll see if we want to add anything to what we just discussed. But how can employers strike the balance in a workplace safety climate between machismo and complacency?
This is Anthony, and I think it's a very similar, very similar approach. I think if supervisors and employers make it clear that machismo, I guess, is pretty broad, but machismo that involves a disregard of risk and safety or a cavalier attitude towards safety, I think if they make that clear that that's not the goal of the workplace. I mean, the goal is to complete the job and complete the job well, but also to send everyone home in the condition they arrived in that day. Then I think it very quickly becomes clear that that's not. That attitude, that approach, doesn't jive with the machismo risk-taking attitude, and so I think there are a lot of non-prescriptive ways for an employer to do that. A lot of leading by example ways that don't come across as lectury, but I think that the same principle is key.
Hi, this is Todd. When I hear those two terms, I just think that there's no room for them in workplaces. Unfortunately, in a few recent reports that we've written up, we've cited things like those as contributing factors, and really, like mental health in the workplace, those things just need to be called out by employers, defined, exemplified, and just eradicated. Employers need to, get it in the heads of everybody that it's just not acceptable, and they need to, workers need to look for it, even report it. So I don't think there's any balance between the two. I just think that those just can't be in the workplace.
Yes, and if I may add to what Todd and Anthony said, again, I want to emphasize the importance of connecting the workplace with outside the community. There's nothing macho in living a family behind. So connecting these injury stories with the aftermath for the family, could also be an instrument to change the culture. And I also subscribe with the leadership approach. It has to start from the top.
All right, excellent. Now this next question is about heat stress. So someone saw a report on heat stress among construction workers in Texas as a contributing factor in some fatal falls. When evaluating falls, how do you consider heat stress or other similar factors?
Well, when we write our investigation reports, we always include a section on the environmental conditions. To my memory, in the last 10 years, I can't think of a single fatal fall that was related or had a circumstance of an extreme temperature involvement. So I really can't comment too much on that.
Mm-hmm. Yeah, this is Anthony. It's hard unless that worker mentioned to someone else, who is then someone we get to interview, that perhaps they were feeling dizzy or lightheaded because of the heat or something. The info we include in our reports is generally limited to what we can, like as I mentioned, get voluntarily from people who we interview. And so that's kind of the limitation. But if someone mentioned something like that, as Todd just said, it would definitely be included in the report.
Excellent. All right, so there's one last question that says, we're out of time, but I wanted to touch on this. The one question says, do you have any statistics on elevator construction and repair related to deaths and injuries? And there is a report from CPWR's data center, and Jessica will provide that link in the chat as well as the email for anyone who's interested in that question. But we are unfortunately out of time. We did have a couple of live questions come in, and we will not be able to get to those. The presenters did give you their contact information. If you want to follow up with them directly, please feel free. Again, we want to thank Dr. Todd Schoonover, Dr. David Hurtado, and Dr. Anthony Oberry for taking their time to present on the FACE programs across the country.